Songs.
It's on. Okay, so my name is Kara, and cohort 0513, and we are talking about group cohesion today. So I'll just read a bit of the history here, background. So group therapy is a form of psychotherapy that involves sessions guided by a therapist and intended by several clients who confront their personal problems all together. The interaction among clients is considered to be an integral part of the therapeutic process. Irving Yalom, who created the interpersonal approach to group therapy, was educated at Stanford, and he was strongly influenced by psychodynamic and phenomenological thinking. He has been extremely influential in the practice of group psychotherapies, and he's published numerous books, including the one we're reading, and Existential Psychology. In dealing with people's problems, Yalom sought to work them out in a group setting with a here and now focus. In this focus, the therapists facilitate interaction with the group, with issues taking place in the group. Members are discouraged from talking about their past issues or events occurring outside of the group. And then when each member of the group expresses some interactional problem, they are then asked to find someone within the present group who is similar to a person they would deal with in their regular lives. Conflicts and other issues are then worked out in vivo. In Yalom's view, the group is a microcosm of other social groups, such as families and even society itself. So in order to reinforce the effects of the group, Yalom feels that therapy should become the most important event in a client's life during the therapy session. Yalom has outlined the process underlying this group, calling it the curative factors in group therapy, with one of the most important being group cohesiveness. So cohesiveness in group therapy corresponds with the therapeutic relationship in individual therapy. The therapeutic alliance is the most valuable variable in individual psychotherapy research. In group therapy, it also includes the relationship the person has with others and the group as a whole. Cohesiveness in group therapy represents the we-ness, or amount of groupness. This provides the group with a better defense against any external or internal threats. Yalom defines it as a member's desire to remain in the group and as the experience of warmth, acceptance, and being valued. Of all aspects of cohesiveness, it is the aspect of sharing one's inner world while being accepted by the others, which directly affects or influences self-esteem. One theory of group effectiveness is that some patients have a poor group history in their life. Therefore, by internalizing the atmosphere of a cohesive group, it augments a process of self-acceptance or self-cohesion. Greater cohesiveness also increases disclosure, attendance, intimacy, and social risk-taking. However, this acceptance of others may be challenged by how participants accept themselves. So when you're setting up a group, the therapist needs to have a good deal of information. A screening interview, a psychiatric history, and a mental status exam can help to select appropriate patients for group therapy. Also, there are inclusion and exclusion criteria. Inclusion might be like the ability to form group tasks. There are problem areas that are compatible with goals of the group and motivation to change. Exclusion might include incompatibility with group norms for acceptable behavior, inability to tolerate a group setting, severe incompatibility with one or more of the group members, and a tendency to assume a deviant role. The size of the group usually is between 8 to 10 members. Successful groups have been as small as 3 and as large as 15. Patients who have different diagnostic categories and behavioral patterns, and patients from different races, social levels, educational and backgrounds should all be brought together. Patients between 20 and 65 can be effectively included. Whether these differences that they have are social, working, or in couple relations, participants can all benefit from all of these areas. Groups are well suited to people who are struggling with relationships, and if they are in a circumstance where they're sabotaging relationships in their lives. So the great advantage of group psychotherapy is working on these patterns in the here and now in a group situation that's more similar to reality and close to the interpersonal events.
My name's Davina, and the most important group counseling concept for a psychiatric nurse is to master group cohesiveness. When applying the importance of group cohesiveness to nursing, it goes without saying that group cohesiveness is absolutely required in any group in order to facilitate change. One way in which to encourage group cohesiveness is through the development of group norms, which is the standards of behavior and attitudes to which the group abides by. All groups need to have a set of norms that may apply to everyone in the group or even to certain members only. Some norms may be strictly observed, whilst others may be more flexible. As a group develops, these norms help to minimize individual differences in personality. Norms operate at the group level rather than at the individual level, and group norms usually function to maintain the group and preserve its integrity. Group norms can be explicitly set out in a constitution. So in this case, a new group member would be given a list of rules and regulations, aims and objectives. This is most likely to be standard practice in long-standing groups. However, group norms can also evolve over a period of time, and in newly formed groups they are often unspoken or implicit. A new member of a group will gradually become aware of what the group norms are and will usually make an attempt to alter their behavior to conform to the norms. Explicit rules that I have seen applied in my nursing practice are to begin and end on time, attend as many meetings as possible, listen to the current speaker without interrupting, not to use hostile or inappropriate language or body language, and be respectful of other members of the group and their ideas. Although the norms appear simple in nature, they are important to state in order to keep the group in order and functioning at a level where everyone feels comfortable to contribute and understand their boundaries.
Okay, hi, my name's Faith. I shared online that I was a personal development facilitator with people who were mandated or coerced into groups. And so I wanted to look into group cohesiveness and how it can be negatively impacted. And so there's a number of things that can negatively impact group cohesiveness. And one of them is conflict. Disagreements within the groups are common and often a healthy way of building, and it's having these disagreements is often a healthy way of building cohesiveness, because if people disagree on a point, they'll have the opportunity to explain why and perhaps offer alternative solutions to the problems of the group. Conflict and further discussion can be a good way of reflecting and clarifying the aims and objectives of the group and can enhance understanding by taking in the viewpoints of all the group members. Conflict only becomes a problem when comments become personal towards an individual or subgroup of individuals, or discussion takes up too much time to the detriment of the group's purpose. And strong group leadership and cohesiveness will enable disagreements to become positive for the group and the individuals in it. Another thing that can impact group cohesiveness is non-participation or withdrawal. Everyone has the right not to participate in a group when they're in a group, although it's preferable that all members contribute in some way. Some members will prefer to observe rather than participate vocally, and others may wish to contribute but feel too shy. They fear self-disclosure or they lack confidence. To overcome lack of self-confidence, where members wish to contribute but are afraid to, their non-participation needs an encouraging positive approach. However, they should not be embarrassed or pressured to participate. Another thing that can impact group cohesion is monopolizing. There's sometimes when one person in the group will have a lot more to say than the others, and this may be the case, for example, if one member has a focused area of expertise which needs to be shared with others. Monopolizing, however, refers to one or two members dominating the group at the expense of other members' contributions. The leader or facilitator may reduce this problem by first acknowledging that what the person has to contribute, and then diverting the discussion to other people. asking their opinions and moving on. If it can't be dealt with in the group, the best strategy may be to discuss the problem with the individual concerned in a way that is sensitive and positive and does not dampen their spirits or stop their future contributions. Fourth one is scapegoating. When things go wrong in a group situation, it is sometimes easy to direct blame at one or more individuals within the group. This is known as scapegoating and can be very damaging for the individual concerned and also for the group as a whole. In cases of scapegoating, the group leader or facilitator should restructure the group into subgroups for a while to reduce the effect of the whole group scapegoating one individual. And finally, attendance and tardiness can have a negative impact on the group, and it's important to have clear guidelines and consequences. This is an area that can be covered in the pre-group interviews, and I think that in our psychiatric nursing practice, there are going to be lots of opportunities to facilitate groups, and having awareness of what can derail groups a little bit will help develop skills to keep the group together.
My name's Ashley, and I think group cohesion is important to psychiatric nursing treatment as being part of a group that is warm, accepting, and empathetic, facilitates growth, self-disclosure, personal exploration, and the change of self-perception, which in turn is helpful in regards to recovery from mental illness. Being that a psychiatric nurse is an advocate for their client's well-being, ensuring that interactions are beneficial and helpful to the client by having other members of the group have commonalities that allow them to connect, share, and listen to each other, can broaden a personal sense of interpersonal relationships and perceptions of themselves. In psychiatric nursing practice, it is important that when carrying out group work, the group members work together and feel valued and supported, which relates to the cohesion of the group. It is important to master this concept in a group setting, as the cohesion of a group can affect many aspects of the therapy and help decrease dropout and enhance the therapeutic alliance between the members and the leader. By ensuring that the group will work together, the nurse is encouraging an increase in self-esteem and development. Whether a nurse is working in a hospital or in the community, group work is an important part of recovery. In the hospital, facilitating interaction between the patients on a ward can help enhance the atmosphere of hope and empowerment. With this being said, the hospital can bring a wide array of patient demographics, and therefore the nurse must be able to correctly identify who may be beneficial to have in the group and who may be destructive, and deal with these distractions appropriately. Being that a main element for successful group therapy is the desire to change, groups that are run in the community may have more of a focus on recovery and the change process. In the community, it is important to be selective when preparing the group in order to ensure that the group will be cohesive and effective for those involved. It is evident that group therapy can have many benefits for those who are working towards recovery and to promote reflection and personal exploration. The nurse or group facilitator must be fully competent to facilitate and encourage cohesion within the group. Not only is this an important element of nursing practice in relation to group therapy, but also in regards to working as part of the mental health team. In working in mental health, cohesion is an essential element in planning care and promoting wellness, as working together to achieve a common goal, both staff and clients, will have a more therapeutic outcome and aid the individual in their recovery journey by feeling supported, accepted, and having a sense of belonging.
All right. Thanks, Ashley. I just made some notes here about what I was thinking, just from groups, a few groups that I've run in the past. And so a few things I find quite helpful are goal setting. And goal setting can create group cohesion because you have two factors, competition and success. So you have two sorts of, when you have goals, everybody kind of bands together and, works towards a vision. So even, you don't have to do the little, there's not so much interpersonal stuff right at the beginning because everybody's focused on that same thing. So you just kind of end up working together. But goal setting does provide a source of intrinsic motivation. And then competition is also extrinsic. So it kind of, speaks to both of those areas, and it can, that can help your group to gel. Also numbers, I think we probably all have mentioned that to some degree the numbers do, play a factor. If you have too few, it's really easy to handle because you just have a couple people. But it's not as diverse, so then it's not, potentially not as creative, and there wouldn't be it may not be as productive. If you have too many people, it's kind of a bit of a cumbersome thing. I mean, your productivity and creativity would be a lot higher. So it kind of depends on what you're going for, but they can be harder to manage. Also, if your group is too cohesive, that could be an issue too, because sometimes then you get like, you know, lazy people, and they think, oh, like if your group is so solid, they're like, well, I don't need to share or give any input because so-and-so's, you know, they'll speak up, they'll say something. So then people start to, you know, kind of mooch off the other folks in the group. So you have that. And then I think another thing that's quite nice that I've found that, you know, really bolsters like a sense of cohesion in a group is when people feel like they're in some sort of exclusive club. So if they've had to go through some sort of like interview process or screening process, or in some way they know that, like, you know, 6 random people off the street weren't chosen, or you just took anybody that applied, like there was some, you know, something that they had to work for. So what I like to do in groups is, I just made a few notes here about things that I find important in groups. Number 1, and most important, is to have fun in my groups. They're always fun. So whether that looks like smelling the smelly markers, because I think that's great, you pass them around, everybody smells them, and then, you know, talk about it for 5 minutes. You could go outside, you could laugh. On the last day, you could, you know, tell them that you're going to provide lunch. Depending on the population, this can be like a very big deal if you have pizza on the last day. And especially if you have consumers who don't have a ton of money or anything, like pizza that they can just, you know, all you can eat type deal, that'll make your last day quite well attended. Establishing group norms, so if you hold the same group at the same time, at the same place, if you ask everybody to turn off their phones, if you ask for a certain level of attendance, like everybody has to be there 70%, that people are polite, you can make your own little thing at the starting of the group. I like to do team building. So on the first day, if your group is over 6 sessions, longer than maybe 6 sessions, you can do a personality test and kind of discover like how people communicate and stuff, and then post those results, clump them so everybody sees where everybody else is at, and then usually have some sort of team building skill-based thing where you all have to work together to complete a task. Introductions on the first day are really good. I like to take the group temperature at the beginning of every meeting, and I have a few ways that I like to do that just to keep it kind of like fresh and interesting. And then also, invariably there's going to be conflict. So if you are open about it and you tell people that conflict will come up, and then you're always available at the end to discuss it with anybody, or you're open to chatting about it even with the larger group, I think that goes a long way.
Questions? Yes, actually. Kara, you mentioned that you think doing a check-in with everyone at the beginning of the meeting is important.
Oh, yeah.
What does this look like in practice? How would you do it?
Okay, so, yeah, so like, I was just saying, so I get the temperature. See, because you want to know, what are you walking into? You know, these people are meeting you. It might be the afternoon and they've had all kinds of garbage going on in the morning, or they could have had a great day or great week. So, I don't know where I learned, I must have seen this somewhere, I'm sure I didn't come up with it myself, but I like to use metaphors, so to get people to explain kind of where they're at. So I would, if this was our group, I would say, all right, everyone, let's go around and everybody kind of do like a 2-word synopsis of where you're at, describing yourself as like a hot beverage, or as a weather system, or as a car, or a song, or a movie, or use something else that kind of would parallel. So then by what they say, if they say they're a broken down whole clunker of a car or something, they might not be feeling ship-shape that day. And then you can, you know, if it's something like that, you can just, like, for 2 seconds, just kind of reframe what they're saying and, like, okay, it sounds like you're not feeling, you know, and it sounds like you're not feeling like you want to be eager today or whatever. And then they can kind of say yes or no. You get like just a super quick check-in, and then you just move along. And then it's, you know, sometimes it's a little bit of a laugh because some people come up with some wacky things, you know, like if you do like the hot beverages, and they'll go off about some big long like Starbucks drink order or something. And so it's just, and some people get lost in that, and then they just forget what they're doing. But overall, I like to do that. Gets the juices flowing right straight off the bat. That's what I do.
I have a question for Faith.
Faith, you shared that you facilitated groups of mandated participants. How did you handle this type of situation?
Well, I was pretty inexperienced when I was doing this, and a lot of the clients, or what the situation was they were mandated to be there by the Ministry of Income Assistance. No, what is it called? Ministry of Employment and Income Assistance. And so they were told that they had to attend this 6-week group, or they risked being cut off their income assistance. So needless to say, a lot of them were very happy about being there. Many of them also had substance use disorders. So the people that were there voluntarily, it was, you know, they wanted to be there, so that made it easier. But the ones that didn't, quite often, they were the ones that had the substance use disorder. Would challenge me, and when we did a very brief part on addictions in the 6 weeks, and so they would challenge me immediately. One of the things that they ask is, well, have you ever had an addiction? And I haven't. So right away that creates a wall between me, the facilitator, and a lot of the group members. And so I would remind them that it was a personal development group, and that it wasn't specifically aimed at substance use. But I would try to build some common ground. And so I would ask them, have you ever experienced anxiety? And most of the people in that group had. And I said, we can talk about that. I can talk to you about that. And they'd say, I'd say, have you ever been in an unhealthy relationship or had unhealthy people around you? And they'd say, oh yeah, I can talk to you about that too because I've experienced that. So what I would do is I would kind of break stuff down that they might have experienced, so that to show them that we do have a lot in common. It's just not the substance use. And you know, it worked with most. Some it didn't, but with most it really helped.
Okay.
Yeah.